Hi, how's it going? My name is Dr. Martin, and I will be conducting your cranial nerve exam, as it says on the file. Let me see here. Wait a minute. This isn't the right file for your, It's those nurses. They always give me the wrong file. Give me one moment. I apologize about that. Let me go get the nurse to give me the correct file. Nurse, what are you doing? This is not the right patient for the file. You gave me file for again. This is not the right file. I need the right file for the patient. I have a patient in the room. You gave me the wrong file again. Looks good. That's gonna go on your record. Thank you. Don't let it happen again. Sorry about that. I'm just over it with these nurses giving me the wrong file. But we got the right one, as you can see here. It does say your name up at the top there. That's good. Alright, so let's see what kind of paperwork we got going on here. Let me first, let me go ahead and get your name down. And your last name and a good contact information. So your name was what now? McFlurbin. So, is that with a C? Flurbin. Alright. Your last name? You forgot your last name? That's okay, we don't need that. We just need your first name. We can contact you by email or phone number. You get your phone number and your email contact information if that's possible. Email, we'll write E and then P for, so the E is going to be for email and P is going to be for phone number. Let's start with email. Do you have a good contact email we can use to send you promotional offers and news updates and doctor visits and whatnot? Okay. That'll work, as long as it's the most recent email. Now, if I could get your phone number, please. Is that with a... Okay. Oh. Is it now? Alrighty. We're just gonna make sure we put this in... Let me go ahead and put this in our system here. And we'll get right on that exam. Let me just... make sure we get the right patient up on this system here. Alright, and then what was it? Email. Let me just put that aside. At Yahoo. Oh, it was Gmail. Okay, let me update that into the system. At gmail.com, and then so the phone number was alright. I think that's all we need to do on this, so put that aside. And here I was looking at your chart and it says you need a couple shots and you need to get some blood work done from your physician. Is that so? Oh, don't worry. They don't even hurt. It's just like a little bee sting or a little pinprick. I wouldn't be too worried about those. Me, I get those a lot. Yeah, we'll make sure that they go by quick, and our nurse here is gonna be professional about it, because they always like to mess. But anyways, it's just. You just need to get 2 vials of blood drawn, and then your flu shot and a booster shot. And for the booster shot, you get them at the same time as you get your flu shot, so it just kind of works in tangent with each other. And then the 2 blood work vials, those are gonna be just to test your cholesterol and if you have any kidney or anything like that. But other than that, we'll see what we can do. All right, let me put my trusty pen away. All right, let's go ahead and get a listen on those lungs there. Let me just clean up my workspace just a little bit. All right, how's your day been so far? Let me just put that in the filing cabinet. All right. It's just one of those days. Let me go ahead and take a listen here. You said you were feeling kind of raspy, like in the chest area. Okay, we can see what we can do. I need you to breathe in. Oh, sorry. Let me first ask you if I can come in a little bit closer. That's fine. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Alright, I'm gonna turn this around and get a better listen here. Breathe in. Breathe out. Breathe in. Breathe out. Alrighty. Let me go ahead and go around to the back here. Because the lungs have different, they have different alveoli, so you gotta be prepared to listen to those. Breathe in, breathe out, breathe in, breathe out. One more, breathe in, and breathe out. Alrighty, let me go ahead and get a listen on your pulse here on your arm. So if I could please borrow your arm. I didn't mean literally, just, you know what I mean. Alright, let me go back to that one. Alright, so you borrow your wrist here. Okay. Okay. Now one other little check I need to do. Let me check your jugular and your come on, man, it's coming. The jugular vein and your carotid artery. That's it, the carotid artery. Just to make sure you're alive. Yeah, I hear something in the carotid artery. Let me move on over to the jugular here, just to see if I can hear anything. I do hear blood flow. That's always good to hear blood flow. That does mean you are alive. Alright, so let me just see what we can do about that raspiness in your lungs there. I think the first thing we're going to do is we're going to take a look at your mouth, because there could be some imperfections, or there could be, something. I just need to take a look in your lungs, in your mouth, and see if there's anything alright in there. Alright, so please open wide for me, and we're going to use this little tool here and just take a little look. Okay, that looks good. That looks good. Yeah. You have how many teeth now? One. I think you've got about 2 teeth. You've only got 2 teeth. You do know that teeth do regrow, and they'll grow out of your mouth. But I do understand the whole being slow on the growth spurt. That's how some people are. They slow, like their hair grows slowly, or I understand. I do. Alright, so let me just check in the mouth. Alright. Get some picking. Alright. think your mouth looks pretty good. Yeah, I would say so. You know what? I would like to do, actually. Let me go ahead and put some of this paste down. It'll help whiten and clean up your breath and your tongue. It's this new formula, and we apply it around the gums area and up on the top upper gums, just to help clean up. It's kind of like toothpaste, but without brushing your teeth. So if it's okay, would you like to try out this new product that we've invented? You would? Okay. Yeah, but basically you just put it around the gums, kind of like that, and it'll do the cleaning for you. No brushing. All you do is use a little bit of water, mouthwash, mix it all together, and just spit it out, and your comes out twice as clean as if you were to use a toothbrush. Because if you use a toothbrush, it just scrapes off your enamel, and it's not good. So we're gonna go ahead and use this little container here. It is natural. There's no like chemicals, obviously, because it's going in your mouth pretty much. But we've got some flavored ones and unflavored ones. Which one would you prefer? You want a flavored one? Okay, so we're gonna leave. Let me go ahead and switch this one up for a flavored one because it says unflavored. Some people are kind of nitpicky on that kind of stuff, but yeah, I think I got a flavored one. You want a mint? We got mint. We got strawberry, vanilla, chocolate. You want chocolate or vanilla? You know what? Here, how about we try the let's try the mint one, because that's a fan favorite. Alright, let me just get this lid off here. Alright, we're just gonna go ahead and get some on our hands here. Alright, now I'm just gonna kind of work it all in. Just gonna work it in your mouth here a little bit. Just a little bit into your gums. You gotta work it because it's kind of gritty, like sandpaper, like gritty, like sand. It's not sand, but it does, work better than using a toothbrush, because it'll get back into here and here. Toothbrushes won't do that. At least the ones that I sell don't. Alright, we're gonna go ahead and get a little bit more here. Alright, let me just get a little bit more for your front teeth here and your bottom teeth, and we'll get some mouthwash for you to rinse all that out, and your teeth will be looking white as new, good as new. Alright, let me just. How is that? Is that minty? Okay. I was thinking. How is that? Is that okay? Okay. All right. Go ahead and rinse that out. All right. Let me go ahead and spit. All right. All right. The next thing let me go ahead and get back on my notes here, just so we can keep track. Now, it does say the only thing that we need to do is we got that out of the way. Got that. What else do we need to do around here? Let me grab a little something down here and we'll get right on that. Alright, so the next thing we're gonna be doing is checking your scalp. Oh. You said, what was that? That's just that's our doctor's pet, kind of like a teacher's pet, doctor pet, Yeah, I know, I'm not really a comedian, but she just likes to roam around and to greet people at the door, and, we just have her roaming around. But anyways, we're gonna go ahead and check your scalp. and see if there's anything going on in there. If not, we should be good. We might have to apply some paste or something just to make sure there's nothing going on in there. Alright, let me go around back real quick. Alright, so we're just going to go ahead and check the scalp. Just going to make sure there's no lice or dandruff. Yeah, what's that? Oh, you said you cleaned your scalp this morning? Okay, that's good. That's good news. Oh, I'm not really saying anything. Oh, okay. Wait, what is... Yeah, I'm not saying it. I'm just not saying it. It's not there. I didn't see anything in your scalp or in your follicles of your hair. I think the next thing we're gonna do is check your mouth again. Let me just check one other thing, because I thought I saw something in your mouth just way back there. Just 1 minute. Let me just get this other tool prepared and we'll get that going for you. Alright. I think that's looking good. Alright, I'm just going to use this flashlight here. Take a little look. Yeah, okay, there it is. So, let me grab this tool here. And this tool here, and we'll try and get that solved. Oh, you're asking what tool I'm using? It's just a little pick. We'll use that to get, way back in there, because it reaches way back. And then we're going to use this pocket tool. It's just something simple to go back and grab that piece of whatever is back there. And it's not metal. It may look metal, but it's really not. It's got a little different tools on it. But anyways, let me check inside that mouth. Open up wide, please. Just gonna put that in. Alright. Oh wait, there's like a particle or something. Let me reach in there and grab that. Like some food. Did you eat some hamburgers or something? Or maybe a french fry? I think I almost got it. Got it. Yeah, it looks like a piece of lettuce. Is that what's been bothering your mouth this whole time? It's a little piece of lettuce right here. Don't worry, I'm gonna send that off to the lab and make sure it's nothing serious. Because I've had patients come in and say they've gotten food stuck in their gums, and we had to send it off to the lab, and it came back positive for whatever it was tested for. But you shouldn't be nothing worried, nothing alarmed, nothing scared of. It's all good. Alright, let me just make sure we write that down in my notes here so it's updated in the system. Alright, let me make sure I got your address. Let me just write your address down, that way we can send you the results when that comes back. So I'm just gonna write your address down here. Alright. Now, we're almost done here, I promise. Alright, I think the next thing I need to do is, since I've already checked your scalp and your hair, I need to go ahead and apply some medicine for that. Because this will help protect and... Let me just get a little bit of that medicine. It's not really medicine, it's more of a, kind of like a conditioner, but you don't wash it out or anything. Alright, let me just get that going for you in your hair, and it'll make it look nice and pretty much soft, and it'll also protect it from like lice or dandruff, or it'll make your hair look real nice. Alrighty, so that's done that. So that's done out of that one too. We're done with that. We don't need to be doing that. Alright, now the final 3 things that we have to do on our checklist here is I've got 3 pads here. I can't tell you what they are, but you just have to tell me, and use your senses, because this is a cranial nerve exam. I just need you to tell me what you smell, and I'm gonna put something under your nose. I need you to cover your eyes, and I will. You just need to tell me what you smell. All right, and then go ahead and close both eyes for me, please. Thank you. All right, and you smell that? Yeah, is that alcohol? Okay. I think I got another one a good smell here. Let me go ahead and reach down and grab that one. Alright, I don't think I need these anymore. Alright, let's see. Tell me what this smells like. See? Tricked you. It's not alcohol. It may look like it, but it's not. It's actually cinnamon. So that's that one. I think I got one other scent here. Alright. What do you smell? Take a good whiff of that. Think about it. Cranberries. Never heard anybody say that one before. Alright, well, seems like you've passed flying colors on this olfactory nerve. Alright, well, looks like we got one other thing for you here, and you'll be on your way to the blood bank. Or not the blood bank, sorry, the lab, because you do need to get that shot and get a couple blood work done. But before you go, I'm gonna let you take some Advil just to alleviate any of that kind of stress. Let me just go ahead and open one up for you here. Get a couple Advil out. Alright. And just put the lid back on because you don't want that spilling out. Because we've had a couple people try and take some Advil without telling anybody. Alright, just go ahead and take these. That'll help you relax a little bit. Alright, so my name has been Dr. Martin. It's been a pleasure meeting you and doing your cranial nerve exam. All you need to do now is go down to the 4th floor. Sorry, go up to the 4th floor, not down. Well, I guess depending on where you're at in this hospital, but go up to the 4th floor, turn left, and you will see a sign on the wall that says lab. Go there and get the, I'll give you the paperwork here, some printouts. There we go. I think this is for your lab work. That's for your lab work. I'll just put that aside for you to take down to up to the 4th floor. And yeah, that'll. Let me take my mask off real quick. That way you can kind of see my face a little bit better. So yeah, I just need you to go up to the 4th floor, get that blood work done, and we'll send you your results here in a day or so. Thank you for watching my video, and please subscribe. Thanks.